Increasingly, healthcare providers are using mobile pads and tablets and other things as they provide care. But what's exciting is that this provides an opportunity to get more things into the hands of consumers, so into actually the hands of people with the apps, the iPhone apps or the Android apps that they might use. And then also, as I talked about earlier, text messaging that they can use to connect with their provider or connect with a nurse for an appointment reminder. We actually did this trial a few years ago looking at whether we could use text messages to change behaviors in a theory-based way to reduce weight in overweight adults. So this is funded by the National Cancer Institute. This is just an example of the sorts of things that one can do. So we developed messages based upon what we thought would work and based upon our prior work in intervention research. We also use small little picture messages, sending messages back to folks on their cell phones, so pictures of serving sizes and other things. So a lot of this is really changing pretty quickly. I think increasingly what we often now go to the doctor for might be taken care of through more applications and things that can be handled on a phone. One of the things that's exciting are the newer pads that are coming out that have front-facing cameras, and so I think we've been talking about this area of telemedicine for a long period of time. But in the old days, it used to be the standard sort of box sitting in the corner, and your doctor would communicate with you in a very stationary way. But imagine having this ability to have, the small little pad that you pull out of your purse or your pocket, and you're just communicating in real time, and you get a quick, almost like you would send a text or an email. Because one thing we're very interested in is whether or not it's going to, at the end of the day, change health outcomes.